Hola y bienvenidos a otra transmisión de Diario Digital sobre el coronavirus. Estamos intentando mantener a todos nuestros amigos y audiencia informados sobre esta crisis sin precedente. Antes de nada vamos a hacer un repaso de un poco de las noticias que han ocurrido hoy. Este día el Congreso de los Estados Unidos aprobó el paquete económico de 2 trillones de dólares, 2 billones en español de dólares, un estímulo para movilizar la economía durante estos tiempos difíciles. La Guardia Nacional en Missouri ha sido activada para ayudar en la crisis del coronavirus. También el gobernador dio cifras nuevas sobre los nuevos casos en el estado de Missouri y el aumento ha sido bastante, 146 casos con una fatalidad, y en Illinois se reportan más de 3.000 casos con 28 fatalidades. Hoy con nosotros tenemos a un invitado especial. Él es profesor asociado de la Universidad de Saint Louis. Se llama Onésimo Sandoval, Nes Sandoval para los amigos, y vamos a hablar con él hoy. Va a ser en inglés. En un futuro pondremos los subtítulos en español para que los que no puedan seguirlo de inmediato lo podamos hacer más adelante. Están sintonizando Diario Digital. Agradecemos que estén aquí con nosotros. Y vamos a ir con Nes aquí en un momento, a ver si lo encontramos. Hola, Onésimo, how are you?
I'm doing good. How are you doing?
I'm doing well. Thanks for being with us today. We're trying to understand a lot of what's happening with the coronavirus. Every day we check the news and we see these scary numbers growing every day. And people are wondering what some of those numbers mean. And what kind of a trends. We're talking about bell curves, we're talking about flattening the curve, and we just wanted to kind of get a little bit of understanding about these numbers and how we should be reading them and understanding them.
Absolutely. So, well, thank you again for inviting me to talk a little bit about numbers. So I think probably the big picture, that the main point I would leave your audience with is that the type of public health challenge we're dealing with today is a virus, and the virus that's impacting populations is something that grows mathematically in what we call exponential, which means that it's a curve that's growing, but as it gets onto that curve, it grows faster and faster and faster, and at some point it reaches what we call an inflection point. And then once we see that inflection point, it'll grow even faster. And so that's the concern that a lot of public health officials have, is that we know that many people are going to be affected with this virus. We just want to make sure that it doesn't get to that point to where the number of people who need medical attention outstrips the resources that are available. And so when we talk about we want to flatten the curve, what we're saying is that we want to make sure that it doesn't grow exponentially, but that the growth is over a period of time. And so that's really the big point here in terms of why these numbers are important.
Now, with the statistics, it's sometimes a lot of information out there as terms to what we should be looking at. Is it a death rate? Is it an infection rate? Is it a growing trend on that bell? What are the numbers we should be paying attention to?
This is an excellent question. And so we are in the process of actually doing what we call a meta-analysis of different websites that are out there that are available to the public, to try to analyze what these websites are providing in terms of data, the metrics that are being used, is the methodology available to the public, and then what they're trying to do in terms of providing a lens into the future. And so not every website is created equally. So one of the first websites that was created was by Johns Hopkins University, and I think that's the one that most people will use to kind of track the numbers that are there. And on their website, they provide some simple matrices that the total number of confirmed cases, the total number of deaths, and those that are recovered. And so they have a very simple measurement in terms of how they're conveying information, and then they're overlaying that information over a map. And so I would say that's one website that I would recommend people to go to. There's actually another one that I think is a little bit better, and there's actually two. One is by the Financial Times, and it made it free and it's available to the public. And what they're doing in their website is they're actually providing, if things don't change, this is what the future looks like. So that's a little bit different website in terms of telling people this is what we can expect in the next 2 weeks if we don't shelter in place, if we stay home, we don't interact with the public, how we can flatten that curve. And so that website's actually a good website to kind of tell you what's happening in the future based on current conditions. But what's nice about that website is it provides not only what the future looks like for each country, but now it's starting to provide what the future looks like for each city, which is, in the case of the United States, New York is becoming this focal point of attention to see how New York's going to look like in 2 weeks from now. How does that compare to Atlanta, Detroit, Los Angeles, and so forth? And so that's an excellent website in that sense, in terms of it's nice to know what's going on at the U.S. level, but the U.S. is a very big country, and it has cities that are very big on the East Coast and on the West Coast, on the North and in the South, and so not every city, not every trend is going to be the same. And so I think we need city-specific data to kind of tell us what's happening in each cities and what we can expect the shelter-in-place to look like.
Now,
so,
as
we
do
want to keep. Go ahead.
No, I'm sorry. Go ahead.
So I think we want to use the Johns Hopkins site as a baseline because they're just providing basic numbers. But then we have something like the Financial Times, which is saying we need to look at city-specific information, not only in the United States, but cities in Italy and France and in China, to do city-by-city comparisons. And then there's a third website that I would recommend, which is Our World in Data. And what they do in this website, which is very nice, is that they provide some very important information about how fast is whether we look at cases or deaths, what's the doubling time, what's the expectation of what will happen. And so let me give you a few numbers of what as a demographer, what we're looking for starting today. So the doubling time for cases is about 7 days. So right now there are about a little bit over 500,000 cases worldwide. So if this is correct, next Friday there'll be over 1 million cases of confirmed cases of coronavirus. And so that's a pretty phenomenal number. But in the United States, the doubling time is 4 days. So starting today, and if we look at the data on Tuesday, if we look at the data on Tuesday, we should see that there'll probably be close to 150,000 cases in the United States, if the doubling time is correct. And so that's a pretty significant, we're actually doubling a lot faster than the world average. And so that's something we want to think about. If we think of the death, let's see if I can pull up the death doubling time. Those numbers are pretty consistent there. So that website's very nice because it gives you some concrete numbers to look at. And so I've been telling people that I've been talking to today is let's look at the numbers on Monday morning to see what's going to happen today, Saturday and Sunday, to get a sense, are we still on this doubling time of every 4 days? And if that's the case, then the next 9 days, right around Easter time, could be we could see a very different story in terms of the tragedy that may be playing out in many cities. If we have just more demand for those health resources and not enough supplies. So I think Monday morning, Monday afternoon is going to be a pretty big day for us to see what's really happening.
Now, the data, what does it show on this curve that we have, the bell? How long is that bell? Some people say it's 4 weeks. Some people say it's 8 weeks. Based on what you just told us, we're all going to be racing to the finish at different times, right?
Absolutely.
Washington
So every state's going to have a different. So what the Financial Times has done with their reporting is they actually they report it from 0 date. And so what that means is that regardless of when it started, whether it was January 1 or January 21 or February 1st, that becomes day 0. And then so in Italy, for example, we compare ourselves to Italy, and we always say we're 2 weeks behind Italy. So we moved to Italy on day 0 may have been like March 1st. And then whenever we decide that St. Louis is going to be date 0, we'll say how many weeks behind are we from Italy. So that's one way to kind of think about this. There are multiple stories that you can tell with this data. So we are behind. We're actually ahead. If you think of if we break this down by city, the amount of deaths that are happening in New York, we're ahead of the curve compared to some of the cities in Italy. And so that's why these next 3 days are going to be very important, because if it continues, then we will become the storyline around the world, New York.
Now, the United States is a big country, much bigger than Italy, and we have different populations in different places. They say that Florida, for example, has a larger population of older people. Therefore, they might be more susceptible to the coronavirus. New York is just a massively dense population, and by default, you can expect people to get sick there. What about Missouri? Let's focus on Missouri a little bit. What are the numbers telling us about what we're doing in Missouri?
So the numbers currently right now, we have 670 total confirmed cases. And as of now, there are 9 reported deaths from the virus. I think what's interesting about Missouri, though, it's an outlier. And it's an outlier in a bad sense. Because Missouri has a total of 871 cases have been tested. And of those 871, according to this website, 502 confirmed. So it hasn't been updated yet. But what that tells me is that the majority of the people who are being tested are testing positive. And that should not be the case. The majority of the people tested should be testing negative. So that tells me that in Missouri, we're not testing enough people. And what that means is that we have a lot of people who have coronavirus. They may be asymptomatic, but they're probably spreading it in their communities that they live in.
Yesterday, Dr. Williams, the head of the Department of Human Services, had mentioned that Missouri had not been tracking the cases and the negatives. So there was an imbalance of numbers and reporting. They said they've corrected that, but they only did it in the past couple of days, perhaps just yesterday to today. So will that affect, will we be seeing more and different data going forward?
If that's the decision that they're going to make, it would be yes. But it would have to be a huge, based on the numbers I'm seeing right now, that would have to be a significant change in the number of negatives. But I'm like I said, one of the interesting things about studying this is that the data is changing every day. And so the story I'm saying today could very well be different than the story that we would tell on Monday morning. I think a lot of this has to do with people not going out and gathering in public, it does have an impact. Again, there's probably a 2-week lag period. So we are starting to see what the effects were. But I think we'll start to see if there's any positive. It may start to see it next week. But my guess is that looking at these numbers for Missouri, 670 cases, it's continuing to grow as we speak. Was it 3 weeks ago, we had our very first case around this time period. And so that's a pretty significant change. And so one can imagine in Missouri, if this is still growing at this rate, in terms of the positive cases, whatever that doubling time is going to be, we could easily be over 1,500 cases by Easter. And the death rates will probably be for sure it's going to be in double digits. We may be into the 20s and 30s. So we really need to, I think when we look at these numbers, the quality of the numbers, we just need more people to be tested to see what that rate is, so we can develop some very good models.
So Missouri is a rural state, and the governor hasn't put a priority on locking down certain rural communities just because he said by nature, literally, they're more isolated. Do you agree that this is something that demographically is going to show that people out in more rural areas are going to have lower numbers of the coronavirus? Less contagion?
Let me phrase it like this. The majority of the people in the state live in the big cities. And so if you just look at it raw, you're going to see that St. Louis, metropolitan region, Kansas City, those are going to be your hotspots simply because that's where the large population is. But if you look at the map, you do see that in some of these smaller rural areas, you're starting to see concentrations happening there. And so I was doing some research on what happened in Georgia. And in Georgia, and also and I think Mississippi is going to be another one of these states, you're starting to see, because they have governors who refuse to do a statewide quarantine, you're seeing rural areas have hotspots of contagion. And I suspect that, I believe that there are people who are affected but haven't been tested, that, for example, if there's an event on Saturday or Sunday where there's a gathering, you could see one of these hotspots emerge in the northern part of the state. We do see it here in the south part of the state emerging. And there is some relationship to social economic status, right? So I would anticipate, and this is all said and done, that Missouri will, based on its population, especially the rural population, I would hypothesize at this point that the governor probably is making the wrong call here, and but we won't know that until this is over. But based on what we're seeing initially, I think we're going to see some hot pockets in rural areas that could have been avoided, but unfortunately, that's not going to happen. So I could totally be wrong, and we can see, but I think that there are people who are affected right now who will be gathering with people over the weekend in rural areas, and they may be at big churches, big mass services, and I think we're going to start 2 weeks from now. I think we'll start to see these hotspots in these rural areas. That would be my hypothesis. So that's what we're going to look for. Yeah, but we saw it in Georgia. We're going to see. I've already seen it in Mississippi. I think most people think that Mississippi will probably have to go on a quarantine for the state, regardless of what the governor wants or not. And I hope that's not the case for Missouri. But it is very possible that if we do see a statewide surge in late April, early May, the governor will have to shut down the entire state. I'm not saying that's going to happen, but it's definitely a possibility because of his inaction today.
So Trump has been talking about opening up the country by Easter, which is a few weeks away, seemingly. In terms of Missouri, how realistic is that? You just mentioned that that will be probably the height of our bell, right?
It's one based on the models. So again, this is all based on models. It is possible. Missouri's behind some of these other states in terms of where that curve is growing, and so what we're trying to do right now is to flatten the curve, which we're hoping we're doing. I will say this. Before I give a definitive answer, I want to see what the data looks like on Monday morning. But if there's no change in the data on Monday morning and the trend is the same, you can open up. I don't know what he's opening up because he didn't close anything to begin with. All the things that are closed are at the state level and city level. But if he wants to open it up on Easter, I think it's going to. If nothing changes, I think it could be tragic for a lot of places. And I think it's a long. I think this is March 27th. We're 13 days away. That's going to be a very long 13 days.
Yeah.
I remember when we had our first meeting about the coronavirus at Saint Louis University, and it was essentially 2 weeks ago, and I was telling everybody this is going to be a very long 2 weeks because things were going to change, and I don't want to predict the future, but I cannot imagine opening up California in 2 weeks because California is behind New York by about 2 weeks. And California is the largest state in the country.
We're talking about states that are as big as some nations. So,
yeah, absolutely.
And population density, it just doesn't make it. I think somebody who has a basic understanding of math knows that, right?
Yeah. And so people are saying, like, well, you don't see what happened, and you see it, but it takes time. The way this virus spreads, and it's not within 24 hours that you show symptoms. It can show up within 14 days. And so there's a lag period here that's a little bit confusing for a lot of people.
So tell me how reliable these numbers have been so far, tracking it from China to Europe, now the United States. Is there the proverbial truth in numbers?
Between the United States and...
So we've been tracking the virus since China. Yeah. And we've seen the numbers in China grow. We've seen the numbers in Europe. We've seen the fatalities. And the United States is just getting started now. Can we trust the numbers to predict what's going to happen with, like they say in fact science, or exactly with some precision of exactitude?
Yeah, so this is an excellent question. So there are different websites that are out there that are showing numbers. And so I just tell people, go ahead and look at all the websites, but also educate yourself about what quality of data means and quality of research. So what I like about some of these websites is they're very transparent. So like if you want to challenge the numbers, you can actually go look at the data sources. Other websites are not as transparent. I think, again, this is just my personal opinion because I do have colleagues in China. I think that the numbers from China are probably an undercount of what's really happening there. But those are the numbers that we have. There's numbers here in the United States that people have been saying that we're probably undercounting the number of people who've died from coronavirus, that they got initially were tracked as they died from the flu, but now or pneumonia, but they probably thought it was coronavirus. There are people today saying they're dying of the coronavirus, but they're not being tagged as coronavirus. So we're in the middle of this pandemic right now, so it's hard to really study this scientifically with the type of rigor that we want, because it's changing every day. But there'll be a point, I think, there'll be a point to where hopefully when this goes away, we'll be able to go back and say that these websites, whether it's Johns Hopkins or Oxford or the Financial Times, these were the gold standards. These were the ones that we should use, and then these other ones, whatever they were, are the ones that had problematic estimates. So I'll just say this, that any website that does modeling is going to have a certain amount of error. And so I think your readers and your viewers should have a sense of caution. There's a huge debate about Mexico right now that's emerging today. I don't know if you've been following this debate that, Mexico did not take serious precautions over the past 2 weeks about sheltering in place.
Now, famously, the president has mocked the coronavirus initially.
Absolutely.
I think his tune has changed now, but
yeah, well, I think because I saw some new numbers today, and it appears that probably not having those big festivals over this past week was probably not a good idea. And so some of the new numbers coming out kind of show that, just like New York, that there's probably going to be a fairly significant curve coming out of Mexico over the next 2 weeks, which is unfortunate because it's something that could have been prevented.
So when we talk about the coronavirus, we're going to look at this as a before and after, and some of the data may not be calculated right now. So are we looking at mortality rates other than coronavirus to make links to a lot of people are sick already. They have cancer, they have immunodeficiency disease, heart disease, diabetes, and they say that this population is susceptible to it. Will we look back at the numbers and see if there was any underreporting of corona-related deaths, just to get a more accurate sense of what happened?
I think so, and I'm this has come up with a couple of my friends who made this point that, and actually Rudy Giuliani made this point yesterday about how many people die every day in the United States. So just let me give you one fact. Every 11 seconds, there's a death in the United States. So if this would have been on a normal day and with no panic, about every 11 seconds, there's a death in the United States.
And so, that's without coronavirus.
Yeah, that's just right. What's happening right now. And so when, as a demographer, what we say, whenever there's an epidemic or a pandemic in this case, we call these bumps. Bumps or dents, however you want to think about it. That there's going to be an excessive amount of deaths that happen that were not expected to happen, and that's our concern here. Is like most of these people would probably be alive had it not been for the coronavirus. You know, I'm a demographer. I teach a lecture on mortality, and it's just the basic fact that we are all going to die one day, right? So that's not the question. The question is, as a demographer, as an academic, one of our goals is to improve the human condition. We want to improve the number of years you can live and to extend your life expectancy. If we can do something to prevent these types of diseases, then instead of dying at 63, you can die at 73, right? Our goal is to increase life expectancy. So that's what we're trying to do here, is like we're trying to come in and help people overcome this virus and not die. And so we're seeing unexpected deaths happen here. How many is the question that I think that we're going to try to answer. But I think it's fair to say at this point, people who have morbidities have a higher rate of dying once they get coronavirus than if somebody who's healthy. Now, I've been keeping articles of healthy people dying. So just like any disease that hits you, healthy people would die. There was a case earlier this year where a young person died of the flu. Had no underlying conditions. It just, for whatever reason, that when that person got the flu, it was enough to kill them.
Yeah.
And you'll always have those cases, right? It's just random.
Right. So you've studied the data. Was this a predictable thing? Was demography a tool that could have predicted this pandemic?
Um, there's an article that came out in 2007 that I want to get the original article about it. So people had been writing about this type of virus already in 2007 of the potentiality of it. So I think it was on the radar screen in a small group in the scientific community that this type of virus was possible. Now, whether it was COVID-19, but in 2007 they did talk about the family of SARS viruses, and the implication of what it could mean when it gets out. I think the case with Italy, why demography is important, is that in addition to comorbidity, it's striking certain age groups. And actually, the data I've seen is that men are more likely to be impacted than women. So there are these demographic characteristics where it's having an impact on certain cohorts of a population. That's why the case in Washington was very important, because it was the initial hotspot in the United States, but it impacted an elderly, a retirement home. And so these were already individuals who had other types of morbidity-related illnesses. And so when that virus strikes those populations, it can be very lethal. And so that's a demographic characteristic that I think one of the pieces of work that I hope to do once we get more data is understanding the age-sex cohort effects. So if you look at the Missouri data and you go to the web page,
if you have a website we can share with our audience so they can look at it,
yeah. So if you go to it's Missouri hyphen. The state of Missouri has their own website that they're doing. I'm looking here at the spatial version of it that allows me to look at it by the county. But in that, I can send you the links. But it's Missouri-coronavirus GIS hub. It's a very long website.
Yeah, I know which one you're talking about. We'll share that on Diario Digital so that people have access to it.
But right now, it looks like in terms of this population pyramid, it looks like the peak population is 45 to 55, where you see this concentration happening as of today. And so I think that's middle age. It's not young, and it's not the elderly population that are testing positive for this.
And that's an interesting point, because early on, when we first got news of coronavirus entering the United States, there was this news that got disseminated about, young people don't get it, youngsters don't get sick, and somehow emboldened young people to kind of go out and keep on doing their lives and stuff. Is there any data showing if there's an upward trend or a non-trend with regards to people, youngsters getting sick? We know that in St. Louis County, a 30-year-old woman died from that. So that's fairly young to be passing away from something like this. So what do you think are the truths behind these numbers of youngsters or younger people getting sick? And what's the cutoff? Because what do we consider young? I consider somebody who's 30 young, but maybe they don't themselves.
So from a demographic perspective, we kind of think about these in age cohorts. So so for us, demographically, we would say anybody under 18 would be considered a young population. And then like 18 to probably 30 would be like young adults. And then when you get into, we think of demographic transition. So when you get to 30, that's when people start making decisions about whether they're going to stay married, stay have children, and so that's a different age transition that's there. So typically, when we do analysis, it's always people who are under 18 are separated. They're considered a vulnerable population. And then at the top part, we typically use 65 and over as an elderly population. Because life expectancy.
So what do the numbers tell you? What is there an upward trend in the United States as far as youngsters 18 and younger getting sick, or are they not getting sick at all? Is it because we're protecting them? Is it because we're keeping them home from school and there was early reaction to protecting the younger parts of the population and the older, for that matter?
Yeah, so I think let me look. I think in Missouri, you the second largest age group that's tested positive is 20 to 24. The largest age group is 50 to 54. And so that let's see if I read this right here in this chart here, because this was just updated a few minutes ago. But that's what it's showing here in Missouri. So, and I think from the national data, I'll pull it up here in a minute. I think that's what it's also showing in terms of, I think one of the implications, it goes back to we're not testing enough. The people who are going to get tested tend to be middle-aged or in your population that's working to maintain a family or a household. And so younger populations, they tend to be a little bit more free. And so my guess is that they're not being tested as much as the older population. So if we were to test everybody, I would suspect that we would see more younger people be tested. But I think it has to do with...
Do you think we'll get to that point? Do you think that with the president bringing to bear a lot of the federal resources, it doesn't seem to be a priority coming out of Washington that everybody get tested, but nonetheless, if we had tests for everybody, I think we'd get a more accurate picture as to what's going on, who's sick, who's not, and perhaps respond more in real time into quarantining people and shutting off certain areas or populations that are exposed to it.
That's true, but I think with the young population, I was young once, I remember, I think there's a mentality of I'm invincible, it's not going to impact me, and therefore you're not going to get tested. But I think we're starting to see...
Do you think that has to do with the fact that it was misinformed to begin with?
Absolutely.
Or?
Yeah, I think, and I'm not the only one who's in this camp, we did not take this seriously. And I would include myself. I think I was one of the earlier alerters of what was going on. But I remember I was having these conversations, and I remember paying close attention as a demographer, seeing what was going on in Wuhan. And like many people had never even heard the city, and like so trying to tell people what was happening. So I knew early on in January that I didn't think it was going to be this big, but I knew that this was something significant as a demographer that I needed to pay attention to. And then I knew when I saw the first case happen in Seattle, I started to put my academic hat on and said, we need to start collecting information because this is not just going to be a Seattle story. And so that was very early on where I kind of understood that something significant was happening. And I think we as a family started to become a little bit more cautious in terms of where we were going around the end of February as things started to spread, and like we just need to be more cautious. And then when we were having these meetings, I kind of knew when I saw Harvard was one of the first schools to close. I knew that was going to be the a very pivotal moment. And at that point, we, as a family, we started to take precautions because I told my wife, Harvard closed their school for the semester. We need to start. We need to start taking this seriously, and so we started doing things very different as a family then. And so but even, you know, in retrospect, we should have been doing something in January, which probably should have happened, but we didn't do it. I blame our government. I blame CDC. Not only the federal government, but I would blame local governments, state governments, and I think even we have a responsibility as people that we were still trying to live a normal life. I went to DC for a conference the third week of February, and in retrospect, I'm like, I probably should not have gone to that conference, but I went anyway. And so I have to share some responsibility that I did not. I remember talking to my wife about this and saying, well, I think DC is safe because there aren't any cases in DC. And about a week after I came back from DC, they had the first major case of coronavirus happening there. And so I think our leaders, both at the federal, state, and local level, needed to take this more seriously, to at least send to the population, this is not the time when you get time off to go out and go to a parade or go to a park together and have celebrations. This is a time to social distance and not to spread the infection.
One of the early or late reactions, I should say, was the fact that borders were not sealed. Do you think that would have made a difference if Trump would have? He always touts that he closed the borders early, and that might have. But he closed the borders with China, so that people wouldn't fly from China. But people were flying from China to Vietnam, and then Vietnam they were coming to the United States, or they were flying through Europe back to the United States. So, do you think that an early sealing of those borders may have made a difference, a critical difference back in January?
I think it would have helped some. I think when we start to look at, I don't think there's one patient zero, right? I think that there are multiple patient zeros in the United States, and so I think it had to do with people coming from different parts of the world that were already infected. And so, I think closing it to China would not. I don't think that would have stopped it. I think I remember when he announced that they were going to close it to Europe except UK, and then I think they had to tell him, like, UK, if you leave the travel open to the UK, you have not even solved your problem, because the UK was going to experience the same trend that Italy had. And so, he quickly was convinced, like, we have to stop it to the UK as well, right? I think what we saw here is, like, when things were happening in Europe, they started to close a lot of these programs down that had American students in them. And then the students came back, and many of them already had the virus in them, and they were spreading it. And so I think there were lots of things when we go back, and in sociology we call these a social autopsy. We have to go back once we're past this event. We have to do a social autopsy of what really happened, of all the failures that happened, and the good things that are happening, and write this down. So when it's going to happen again. This is not a one-time event. This will happen again. How will we respond as a society in the future? And I think the lesson that we've learned, at least from my perspective, is that something that's happening in China, we should not sit back and say it's not going to come here, because we're a global world now. We're connected globally, and so even though people's like, well, I remember having this discussion, they're like, why is Iran having this problem? And I'm like, well, you realize that we have sanctions on Iran, and so China and Iran still have relationships with each other. And so once we started to explain this to them, they understood why Iran was being impacted so heavily by this. They were actually one of the first countries where they started to report deaths of senior people in their government that were dying. And so we are a globalized world now. And so I don't think we can ever think that it's never going to come to the U.S.
And that's a good point, because I'm thinking that perhaps in the future we're going to think globalization in a different terms. I think maybe like September 11th changed the way in which we air travel, for example. At airports, we got to take our shoes off, we got to take our belts off, we practically have to get undressed. And that was an event that was really isolated to one time and one place, not something that affected the entire globe, although it had its ramifications, of course. This pandemic is something that's touched the lives of millions, perhaps billions of people around the planet. We're sure to do things differently going forward, right?
I hope we learn our lesson, that an event that happens in another country has the potential to impact every country. And so we have. Can you hear me? I think I have some background, but yeah. So these we have to think globally about a lot of this. We're interrelated with each other now globally, with our economy, culturally, and so I think hopefully when we do our social autopsy, we'll have some lessons that we can pass on to the next generation.
Absolutely. It would be hard to talk to a demographer without bringing up the question of the census. Such an important time of the year. There was a lot of efforts in trying to get people to participate. How do you feel this is going to impact? Do you think there's going to be under-reporting? Or because everybody's home, maybe we'll have an accurate count?
So what I've seen initially is that we're a little behind where we need to be in completing the forms. And so there's tremendous effort right now to, this is being done. The initial phase of this is to complete it online. And so at this point, I think many households, because of what was going on, they just probably threw that letter away, right? So we're a little behind where the census had projected, where they were hoping people would have completed the online forms. And so April 1 is really the official date, right? So when you do the census, it says, where were you living on April 1? I think there's a very strong push right now to get, regardless if you completed, regardless of whether you got the letter or not, they're asking everybody just to go online and complete it. And why I think there's a push now is that they had to close many of their field offices because of the coronavirus. Because the alternative, if you don't complete it online, is that somebody's going to have to go to your house and actually do a face-to-face interview.
And that's still on, to your knowledge?
It's been postponed. And so I think, so over this past week, I don't have cable, so I don't know what's been done on cable, but at least on the channels that we get that are over the air, I'm seeing more of a push to complete your census. And now they're like, you don't need the letter. Just go online and put your address in and it will authenticate you. So that was something different. So, but I know we're behind what the projection should have been.
Should they delay? They've delayed tax filing. They've delayed many elections, municipal or local ones anyway. Do you think the census can and should be delayed?
That's a hard question for me. So, the academic part of me says no, that it should not be delayed. I think the part that I was talking to somebody else about this. I think we're going to have a bad census.
Well, we do it every 10 years, right? It's
Yeah,
a
we do it every 10
decennial.
years.
So does it make sense to just say, look, we'll just do it in 2021 and we'll just wait an extra year? And
But
is
I
that
think what
possible? Is that something that's doable?
the census has it has implications at the federal level. And so if you postpone it for a year, you're postponing changes that need to happen in terms of redistricting, representation of people, funding that has to go with that. So part of me says that we should not. This is something that we should do, and then, but that's a hard call because they were hoping that more people would have completed this online by now than have completed it. And I think that the other implication here is that all these college students went home. And so for a city like St. Louis, I would imagine that it could come up close to 8,000 people short simply from the students not being here. And I think that it's really going to be up to the parents now to make sure, like when they complete their census, they're like, oh, I have 2 children here. I'm not going to count them. But if you actually read the census form, it says as of April 1st, who's living in your house. And so it's going to be too late to educate parents not to count their children who were in college. So I suspect that this is going to be bad news for the city of St. Louis, which desperately needed those college students to be counted. And I think the parents, if you don't know the technicalities of that and you complete the census today, I completed my census 2 days ago. And I'm like, this is going to be hard for the average American to really understand, not to count their college students who are home, who are living in other cities. Because if you read the wording word to word, it says on April 1st who lives in your household.
And you bring up a very important, because not just college students, a lot of people have been shifted around during this crisis. People returning home, people going different places, losing their jobs and moving somewhere else. So that could upset, it almost makes a good argument to postpone the census.
Yeah, so no, like I said, there's 2 parts of me. So I read the academic part that says let's do this, but I understand when I put my other hat, I understand the rationale to postpone it, but it has implications. They're not postponing it is not neutral. It is it will have implications for a lot of states that have seen population growth. Redistricting is going to be postponed for another year. So it's not neutral. It'll have negative effects on communities that should see power shifted to them.
Ness, I could continue on and on and on and asking you questions. I know you have things to do and attend to, so I appreciate your time. Just to wrap up, I'd like to get a sense of, is there anything I haven't asked you that you would like to address to our audience or have them understand about the data coming out on coronavirus?
Yeah, so I would just leave maybe 2 or 3 big points. One point is the epicenter of this crisis is now in the United States. And so, yes, we had all this media attention on Wuhan, northern Italy. It's being focused now on Madrid, Paris, London, but it's not taking place in American cities. So that I think we really need to be careful over the next 2 weeks. If we have to go out, how do we do this in a safe way? I think the second point I would leave with is that, especially for many of your viewers, and is that it's going to move beyond the United States. It's going to Mexico, Central America, South America, and that I have friends in Peru, and you're getting cases there that are being reported. So it's a U.S. story, but it's also become an American story throughout North, Central, and South America. And different governments are reacting to this differently. And the third point is that the story changes every 3 days. We need to look at the data because the story is changing. And so just because we knew something 3 days ago, we have to educate ourselves every 3 days, because it's one of these crises where it's not like 9/11 it happened. It's essentially we're having an event that's similar to 9/11 every 3 days. And so we have to constantly make an effort to educate ourselves on what's happening. I'll leave it with those 3 points.
Absolutely. So, Onésimo, thank you very much for your time. I appreciate it. I hope we can circle around and talk some more as things progress and happen. And I wish you and yours the very best. Stay healthy, be well, and we'll talk soon.
Okay, great. Have a good day.
Thank you.
Okay, bye-bye.
Y hayan tenido una entrevista con Onésimo Sandoval. Él es demógrafo y profesor asociado de Saint Louis University. Nos estaba explicando un poco las noticias de cómo se mide la información en el coronavirus. Este vídeo lo estaremos poniendo subtítulos en español muy pronto para que usted pueda informarse en su propio idioma. Agradecemos su sintonía aquí en Diario Digital. Claro que sí, tenemos diario-digital.com y diariodigitalstl.com. Este último enfocándose en las noticias locales de San Luis. También tenemos otros accesos en Kansas City y Washington, pero ahora mismo están cerrados por razón del coronavirus. Agradecemos una vez más su sintonía. Buenas noches, piensen pendientes aquí en Diario Digital. Estaremos trayéndole más información, más entrevistas y, claro que sí, más información sobre el coronavirus que tanto nos interesa a estas alturas. Buenas noches.